Mark, do you even want people to work for you who are choosing not to get vaccinated? Because I can tell you, I don't want to go to a hospital where healthcare workers don't think it's a good idea.
Stephanie, I've heard that from countless patients. In fact, there was a letter to the editor today in the Houston Chronicle about that, and I've received many other communications. Patients are very commonly saying, I want to be in a healthcare situation where I know that I am safe, because they recognize this is the right thing to do. Doctors, nurses, other healthcare professionals, we have a sacred obligation to keep our patients safe. And that's what vaccines do. We've done this for a dozen years with the flu shot. We see the coronavirus vaccine as even more important. And so we're very proud of our 25,000 employees who did comply with this and who did get vaccinated and follow our policy.
I should remind our audience of that. It is while 178 healthcare workers weren't vaccinated and they're suspended, that is less than 1% of your total workforce. Can you help us understand what would the rationale be? Because when we talk about people not getting vaccinated, we say they don't have access, they don't have the education. Your employees have both.
I think it just goes to show the amount of strong opinion and ultimately, sometimes not following the science and frankly, flat out misinformation that is out there on the internet about vaccines. Vaccines are one of the greatest advances of the last century plus. If you look at the beginning of the 1900s, people lived to be 50. If you look at the end of the century, people lived to be in their 70s, and now it's even gone up longer. One of the key reasons for that is vaccines. They are incredibly effective, incredibly safe, and we've taken them for granted, and we've had an organized anti-vaccine movement that kind of grabbed onto this situation and unfortunately has influenced people even in healthcare. But very importantly, remember, across the community, there's probably 20% of people who are strongly hesitant, another 10% who are maybe wait and see. So, here we're talking about two-thirds, 3/4% of our employees. And so we have seen healthcare workers step up, do the right thing. And I'm so grateful to the 25,000 people who have done that. And I'm sorry we'll lose these 178 individuals, although they still have about 10 days to change their mind and to get vaccinated. But at the end of the day, they'll be better served working somewhere else, and our institution will be 100% safe.
But do you even want them to come back? Have they not shown that they're unwilling to put science first and patients first, which I would guess are your two biggest priorities as an employer?
Yeah, we've said all along we will be driven by the science. I mean, we are a science-based and medically based institution. We have a faith underpinning. We have a set of very, very strong values as an institution that puts patients at the center. So when people say to me, I don't want to put patients at the center by their actions, yeah, they're not people who are a fit for our organization. But again, the vast, vast majority of people have, and we're very proud of them. And, patients can now look upon this institution, and I hope countless institutions to follow, and know that they are incredibly safe places to be, and that they don't have to worry about a healthcare worker not having taken all the possible steps to prevent an unintentional infection, which, of course, no one wants to have happen. And so, again, very proud of what's happened.
Then that leaves me with two quick questions. Do you think this is a problem across the country at all sorts of hospital systems, but other hospitals just aren't putting these suspensions in place? Could it be happening in our local hospitals right now and we don't know it? Because I can tell you, someone like me, I assume when I walk in a hospital, everybody's been vaccinated. Should I not assume that?
You shouldn't be assuming that. And in fact, if you look nationally, I think most institutions are, depending on the part of the country, maybe in the 80%, 85% range at the top in most cases. Many are in the 70s. There was an article just 10 days ago talking about a couple institutions that were talking about their 55, 60% rate. We got to 84% without a mandate. And actually that included bonuses and some very, intentional things to get there, to get the last mile. It really took the mandate. And now if a patient comes here, they have full confidence that our employees, our staff have taken every step to keep them safe. I think patients should be demanding this at all hospitals. And frankly, I think you will see the floodgates begin to open at hospitals. We've seen, a whole bunch of hospitals follow suit. It took a couple months, but they've been following suit. And I think you're going to see many, many more.
quickly before we go, you do have 300 employees that got the medical or religious exemption. Where are you putting those employees? And how did you decide then who gets the exemption and who gets suspended?
So we followed the same process we've followed for, over 12 years with the flu vaccine. This is an EEOC mandated approach. There are some legitimate medical issues. Somebody who's had anaphylaxis, for instance, to other vaccines are contraindicated from getting this. Those individuals will undergo significantly enhanced testing, as well as probably be required to wear higher levels and longer duration of protective equipment. Obviously, we take a look at where they work. There may be some places they simply can't work because, those patients are too vulnerable. There is also a set of religious exemptions. We put in place a committee. It's the same committee that's done this for a dozen years for the flu and used that same process. And at the end of the day, it's a very fair, equitable approach. But that represents about 1% of all employees. And so, we still have the vast, vast majority, almost everybody who's actually been vaccinated.